Welcome to our Healthy Thursday conversation here on the AM show. So on Friday, 24th of January, the Society of Obstetricians, Gynecologists of Ghana, in collaboration with Samira Empowerment Humanitarian and other stakeholders, launched a national cervical cancer campaign with the commissioning of cervical cancer ambassadors to create awareness on the deadly disease. The ambassadors, made up of journalists selected from various media houses, have a mission to drive home the message of preventing cervical cancer. As one of the 10 ambassadors, as I outdoored myself this morning to you here on the show, we have a duty to sustain the fight of creating public awareness of cervical cancer beyond January 2020. Our campaign is on the theme Cervical Cancer Prevention, a Call to Action. So on the back of Seth Kwame Boateng's documentary, Cervix in Crisis, well, we started some conversations on cervical cancer. We've talked about what it is. We've taken some of your questions on it, your fears, can it be treated? Lots of things we've talked about. But there's one area we haven't touched on, and that's our focus this morning. We're talking about myths and misconceptions about cervical cancer. My guest is Dr. Apea-Kubi. He's senior specialist obstetrician and gynecologist with the Greater Accra Regional Hospital. Good morning to you, Doc.
Good morning to you, Your Excellency.
I like that.
Ambassador Mamabi.
It sounds really nice.
And good morning to your viewers as well.
Great, thank you for coming. We highlighted abortion, IUD, because it was such a big deal some weeks ago, and herbal medication. So maybe we should straight away start hitting.
Okay, so the most recent thing that came up was with the IUDs and whether there's any link with cervical cancer. That has been promptly put aside. So we know that there is absolutely no link between having an IUD in place and having cervical cancer. That has been extensively reviewed. There's literature on that that's available. That has said that there's really no link. So we need to dispel that rumor, that myth, because it has serious implications as far as family planning or contraception is concerned. We don't want a situation where people who hear that would immediately rush to the clinic and then have the IUD removed and probably not have any other backup in place. That has its own repercussions as well. So yes, having an IUD has no link with cervical cancer.
Okay, but what would make somebody think that it is linked?
Okay, so so the thing about cervical cancer is related to sex. Once you've had sexual contact before, you are at risk. Indeed, about 70 to 75% of women have had contact with the HPV virus before. Once you've had sex, that's exactly what's going to happen. So having an IUD in place, it's possible that at the time that the IUD was put in place, maybe certain changes may have been occurring on the cervix in the first place if it was not checked. And if along the line, maybe later on, is detected, then there may be, somebody may attribute the fact that you have an IUD with cervical cancer. Okay. That is a possibility. But in actual fact, the two are not linked at all. No.
Okay. Let's go to abortions.
Right. With regards to abortions, again, as I said, cervical cancer is it's as a result of a sexually transmitted virus. If you've had sex before, you're likely to have the HPV, which may eventually lead to cervical cancer. We always say that if you have had multiple sexual partners, or if you have a partner who is high risk, then you may be exposed. Abortion per se, on its own, or having a miscarriage or abortion when you have a termination of pregnancy on its own, does not mean that you have or you will have cervical cancer. All it means is that it's important that once you are sexually active, you've had either an unwanted pregnancy or a pregnancy, you've had a miscarriage, it's important to have your checks done regularly just to be sure that the cervix, there's no lesion or there's no precancerous lesion occurring on the cervix, and that's how you protect yourself. But
Okay.
again, there's no link between abortions and cervical cancer.
Okay, I should have asked this when we're talking about the IUD. If you have an IUD, if that's the family planning method you're on, can you still screen?
Yes, you can, and you should. The IUD has a lifespan of about 10 years, and we're saying that once you are sexually active from the age of 25, you need to start having your pap smears done regularly, every 2 to 3 years, depending on the protocol that is being used. You have to have your pap smear done every 2 to 3 years. The fact that you're on an IUD does not mean that you should stop having your screening done. It can be done even whilst the IUD is in place.
Okay.
Yes.
Let's talk about the herbal medications then. Is it linked to cervical cancer?
I'm just trying to get the context. So herbal medication on its own is not linked. What you tend to find is that, you know, a lot of people, once they find out that this is what has happened, they tend to go to herbal medication as a form of treatment, and we know that that is not the treatment of cervical cancer or even a precancerous lesion. That's not the treatment. So again, there's no direct link between using herbal medication and cervical cancer. But what we tend to find is that a lot more people, maybe because of cost, I don't know, that's a possibility, because we know that in terms of cost, treatment and screening, maybe there are cost issues. So that may be a reason why people resort to that. But again, there's no link to.
So treatment cannot be by herbal methods?
No.
You can't get herbal medication to treat cervical cancer?
No.
Okay.
No. So if you have cervical cancer, the known treatment methods are surgery and then a combination of chemotherapy and radiotherapy, depending on the stage you have reached. So there are 4 stages of cervical cancer. If it's caught very, very early, then surgery can be done. If it's a bit late, then we have to resort to either chemotherapy and radiotherapy. So
you can resort to herbal medication when you have cervical cancer? It can't be a backup?
No.
It can be, you can't do the two together?
No, you shouldn't.
Okay.
Yes.
All right.
Ideally.
There were other ones. If it runs in the family, am I likely to get it?
So there is no linkage as far as family is concerned. So there are cancers that we know have some genetic background, you know, ovarian cancer, breast cancer. Cervical cancer is not the same. So cervical cancer, like we said, it's mainly through HPV, which is sexually transmitted infection. So once you've had sex, you're exposed. So it is not, there's no direct linkage with regards to family linkage that would predispose you to having cervical cancer. So this thing about, some people say that if my mother had it, it means that I may have it, but that is not necessarily the case. We would want you to go and have your screening done. And it doesn't mean, so if your mother didn't have it, doesn't mean that you won't have it either. You understand? So it's all about making sure that you screen regularly and you have a professional, either a gynecologist or a midwife, somebody who's trained, look at the cervix and do the necessary checks to be sure that there's nothing going on. Okay.
And there's another one, if I'm not showing any symptoms, it means I don't have it.
No, no. So the cervical cancer comes up in stages. It progresses. I think it's one of the most patient diseases because it takes up to about 20 years for it to fully manifest. But it starts off with absolutely no symptoms. You know, you have a lesion, or the lesion is gradually growing on the cervix. There are absolutely no symptoms from the beginning. Initially, you may start having some bleeding, you know, after sex, or abnormal bleeding in between your periods, but you tend not to have a lot of symptoms. If you start having symptoms, then that means that things may have progressed pretty far. Yeah.
Okay. So the fact that you're not showing symptoms does not mean you don't have it, or you have it?
No.
Okay. No. There was a last one of, well, even if I have it, It couldn't be treated anyway.
That is not true. There are options, treatment options available if you have cervical cancer. Like I said, it's that depending on the stage that we get you, if you are caught very, very early, then you can have surgery done. If it progresses a bit further, then you can do chemo and radiotherapy. And of course, there are instances where the client may not be able to stand chemotherapy and radiotherapy because these are quite rigorous forms of treatment, and you need to be fit to withstand it. So in those instances, at a point, we may say that we're just going to do palliative care, where we are just giving you treatment to help you deal with the symptoms that you have. So if it's bleeding, then we try and correct your anemia. If you're having pain, then we try and help you deal with the pain. And of course, there's a psychological element as well. The psychological treatment is also important. And again, we need to focus on the pre-cancerous stage. It's important that we try and focus on the pre-cancerous stage. If we are able to get you very early, because there are precancerous lesions. There are lesions which you can have before you actually develop cervical cancer. And that is 100%, that can 100% be cured once it's been caught early.
Okay, what early means?
So where early means you do the pap smear, they identify that there are abnormal cells on the cervix which have not progressed to cervical cancer. That can actually be taken off. Part of your cervix can be removed, or we can actually do what we call cryotherapy or use some heat. Cryotherapy means we freeze the cervix, and then we can also heat up the cervix just to remove the part that has been affected. So that can be treated 100%.
Okay.
Yes.
All right, so if you're watching, what are your own misconceptions about cervical cancer? You can WhatsApp your questions to me right here on the show. Here's one says, if your womb and cervix has been removed, can you still have cervical cancer?
If your womb and cervix has been completely removed, no, it's not likely that you can have cervical cancer. You may be predisposed to having vaginal cancer, which is a different thing altogether.
Vaginal
or vulvar cancer, but not cervical cancer, because you need the cervix, the cervix to be there before the lesion can develop, before you say that it's cervical cancer. And it's important to stress that it depends on the type of surgery that's being done, because when we say we're removing the womb and the cervix, at times during that procedure we may remove part of the cervix, not the entire cervix, because there are instances where it's necessary to remove, especially when it's an emergency, things need to be done quickly just to save a life. You may not be able to remove the entire cervix, and in that case, if the cervix has been left behind, yes, you can develop cervical cancer. Yes.
Okay. This one says, I also hear that when a woman goes through a CS to deliver, has very little chance to acquire the cervical cancer than those women who go through vaginal delivery. Is this true? Jamila from Wager.
No, that is not true. That's not true.
Okay.
Yes.
This one says, good morning to you and Dr. Apea-Kubi. I want to know, if your womb is removed, do you still have a risk of getting cervical cancer? Theodora from Sape Man. We've talked about this.
We just talked about
yes.
that. Yes,
this one says, my wife my wife screens regularly. Can she also go for injection? She's about 50 years.
Yeah, well, the protocol says that we give the HPV vaccine to those who are between 9 and 45. But it's important that she continues to have the screening done.
Okay.
Yes.
All right. This one says, can a lady with offensive smell from the vagina stand the risk of getting HPV? Nana from Bono East is asking.
Well, for that, I would say you need to see a professional and have them investigate what the cause of the offensive discharge is. Yes, one of the symptoms is that you may have cervical cancer. but it could also be just an infection which needs to be treated, and we need to pay attention to that as well.
Okay.
So not every offensive vaginal discharge means that you have cervical cancer.
Okay.
But it needs to be, I mean, samples need to be taken. We need to send it to the lab to find out what exactly it is, and then we can treat it.
Okay. All right. So let me give you the opportunity to give me a quick call now, 0302-211-69102. You can call if you've got questions to also ask. And remember that the focus is on misconceptions. So if there's anything bothering your mind, you're not clear, give us a call, 0302-211-69102. There's a man sending a message, says, if a guy has a genital warts on my penis, am I at risk of getting cancer, and how will I get cured? If the genital wart is treated, still having the virus in my system, I say, will I still have the virus? I'm not sure what that means, but you should know.
Okay, so the thing about genital warts is, so when we talk about human papillomavirus, that's a HPV that we're talking about. There are so many types, over 100 types of HPV. There are some types that we call are benign, and by benign it means that it doesn't lead to cancer per se, but it just forms a wart, like a cauliflower-like lesion on your genitalia or your genital parts. So in this case, what he's saying is that he has a genital a wart on his penis, and that is usually from the benign types of human papillomavirus. Does it mean that it can be cancerous? What it means is that if you have one type, or the benign type of human papillomavirus, it also means that we need to check and be sure that you don't have the cancerous types as well. So yes, he needs to have it checked.
Okay.
He can have a biopsy. He can have he can get screened, just to be sure that it's not a cancerous.
Okay. Let's speak to Cosmos. Cosmos is joining us from Winnipeg. Good morning, Cosmos. Hello.
Hello?
Hi, Cosmos. I can hear you.
You can hear me?
I can hear you. Go ahead. You're on air.
And my question, what I want to find out is my head saw this on the television. The contact. We have a child who has difficulty in mobility. The legs are twisted.
Okay, so Cosmos, just hold on and speak to my producers, okay? Because that's not exactly the conversation we're having. So just speak to my producer. She would take all the details. But if you've got questions specifically linked to what we are discussing, give me a call. This one says, can virgins go for the screening and injection? Enoch Kwamena Donko Junior in Yeji is asking.
Yes, virgins, indeed. We encourage those who haven't had sexual contact before to go for screening, and we expect that the protection would be good for those individuals. Because obviously, what we're saying is that if you've had sexual contact before, you may be exposed. If you haven't had the exposure, the vaccine can protect you.
Okay, this one says, I have some rashes on the vagina wall, but it is painless. Is it a symptom? Nimatu from Tamale.
Is it a symptom? So I would want to, it would be good to actually have an idea of what is being described. Having some lesions on the vagina, we would need to actually take a look, and then if possible, take a sample and then be sure. But it's difficult to say yes or no to that. But it's something that I think that she would have to have checked out, just to be sure that it's nothing serious. All
right, this one says, at what age can someone contract it, or immediately you have sex? Are you at risk?
So once you've had sex before, the chances of you getting the HPV virus is quite high. Like I said, about 70% of women currently have carry the HPV around. So once you have had sexual contact, soon after your first bout of sex, yes, you can have the HPV being carried.
Okay, this one says, my wife complains to me about some fluid coming from the breasts when she presses is it the areola?
The nipple.
Okay. Those, does this have anything in connection with cervical cancer or breast cancer? Jeff from Akachi.
No, not necessarily. But again, once it is not normal to have fluid coming from your nipple, particularly if you are not breastfeeding or So it's something that needs to be checked out because there are certain tests that a gynecologist would want to do just to find out what is it. But it's not linked to. So
and your name in Tema says, can pregnant women get screened?
We usually advise against screening during pregnancy because we don't want to interfere with the cervix. But if it's very, very early in the pregnancy, yes, and then soon after. So usually we do recommend that during the puerperium, that's just after you've delivered. Yes, you can have your screening done, but not whilst you're fully pregnant. That's not advisable.
All right, there's somebody asking for a contact, but also asking, how can I get checked if I have cervical cancer? So let's talk about what you're doing at Ridge.
So yes, at Ridge Hospital, we have a screening center at the family planning unit. We are able to do all forms of screening. So we have the traditional pap smear that can be done. And then we have the liquid-based test that can also be done. And then we also do the visual inspection with acetic acid, which is a lot more cost-effective, you know. So all of those forms of screening can be done at Ridge Hospital. There are a number of facilities across Accra and then across the country where you can also go for screening. And I would advise that if you want to have the screening done, go to the nearest clinic, ask them to direct you as to where you can get the screening done. Usually there should be a contact person within, especially when there's a family planning unit within the hospital. Usually there is somebody there who can do the screening. So, yeah.
All right. There's a direct IUD question coming through, and I think we have to reserve that when we're talking about family planning. But you mentioned vagina cancer, and I thought maybe you should just touch on it in some few seconds.
Yeah, it's a very rare form of cancer, and it's also related to, some of them are related to the human papillomavirus. Yes. And again, for that, similar symptoms to cervical cancer, again, for that, you would not need to take a biopsy to be sure.
Does it also take such a long time to show?
Yes.
Okay. All right. One of the questions somebody asked me was, how long does the man, does it take for a man to give this virus to the woman?
First contact. Once you have it, you can immediately pass
How long
it
does it stay with the man before he gives it?
Once he has it, and he can give it to the woman. Because the virus usually is on the epithelial or the surface, or the skin surface. So once it's there, you can transmit it.
All right, Doc. Thank you very much for your time.
Thank you very
we'll
much.
do this every Thursday. After all, I'm the ambassador.
Yes.
So Dr. Apea-Kubi is Senior Specialist Obstetrician and Gynecologist with the Greater Accra Regional Hospital. The Kolebu Teaching Hospital is also doing half price, so you can go and get the test done. But that ends tomorrow, just tomorrow, so please take advantage of it. Stay with us. You're watching the AM show. Coming up next is Show Business with Maps.